If there's one thing I've learned from watching institutions maneuver under pressure, whether it's a front office defending a risky trade or a palace steadying the ship through scandal, it's this. Timing is everything, and optics can make or break you before the facts even lace up their boots. And that brings us to the moment when the Director General of the World Health Organization, Tedros Adhanom Ghebreyesus, publicly thanked Prince Harry, Duke of Sussex, and Meghan, Duchess of Sussex, for their compassion during their visit to Jordan. On paper, it was diplomatic, gracious, entirely within the rhythm of international courtesy. In reality, it detonated a conversation. Now, here on the Crown Talk UK, we don't do surface-level reactions. We look at the tape twice. Tedros praised the couple for drawing attention to injured children, mental health services, refugee support, and urgent health care needs. No reasonable person disputes that those causes matter. Of course they do. But online, the question wasn't whether compassion is good. The question was sharper, almost surgical. What did the visit tangibly achieve? Because this is where the mood shifts. Did new funding materialize? Were policy corridors opened? Did medical access expand as a direct consequence? Or was this a high-visibility moment that generated headlines but left the machinery of change largely untouched? Supporters will tell you visibility is leverage. Detractors counter that symbolism without measurable outcome risks becoming theater. And in humanitarian settings, theater is a dangerous word. There's also the discomfort around hospital photo opportunities. Whenever powerful or famous figures step into wards filled with vulnerable children, the room carries a weight. You can almost feel the cameras breathing. There is no verified evidence that anyone was coerced or pressured during this visit, and that must be stated clearly. But perception doesn't require proof to travel. If a patient looks uneasy, even for a second, that image can echo louder than any official statement. In volatile contexts, sensitivity isn't optional, it's foundational. And here's where it gets more complicated. The Sussexes, whether they like it or not, function in the modern landscape as both advocates and a brand. That isn't unique to them. Celebrity philanthropy has always lived at the crossroads of image and intention. But critics have begun using phrases like tragedy optics. Harsh, absolutely. Yet it reflects a frustration from some observers who feel that humanitarian crises should never risk becoming backdrops for curated narratives. When the camera clicks, people ask who benefits most from that moment. Then we layer in geopolitics. The region remains tense. Conflicts shift, alliances recalibrate, narratives harden overnight. In that environment, even well-intentioned gestures can appear misaligned. Tedros's endorsement reframed the visit as constructive and impactful. Critics, in turn, wondered aloud whether that praise was institutional courtesy or strategic alignment with a global media story. There is no evidence of backroom maneuvering, no smoking gun, but perception, as I always say, plays like a headline scoreboard, and scoreboards shape public memory. There's also a recurring critique aimed squarely at Harry. Some detractors argue that previous remarks about humanitarian access may have overstated realities on the ground. If that's true, credibility erodes quickly. If it's not, then the criticism edges toward politically motivated noise. But in humanitarian advocacy, precision matters. Words aren't decoration, they're currency. Overstatement can backfire with the force of a misjudged swing in the ninth inning. Step back for a moment, and the debate grows larger than any single visit. This isn't just about Tedros. It's not only about Meghan. It's not solely about Harry. It's about the tension between celebrity humanitarianism and institutional accountability. Should private citizens, however high profile, stand prominently within global health narratives? Does their visibility amplify causes or risk overshadowing the frontline professionals who have worked quietly for years without cameras trailing their steps? On the Crown Talk UK, I find myself returning to one core question. Was this visit about amplifying the issue or amplifying the visitors? That's not an accusation, it's an inquiry, because in today's media age, attention is currency.
Visibility can unlock doors, but it can also distort proportions. A carefully framed image can travel further than a carefully drafted policy. And yet, let's be fair, visibility has power. If even one policymaker, one donor, one government official felt compelled to act because of the attention generated, that ripple matters. The problem is that ripples are hard to measure in real time. Critics demand numbers. Supporters point to awareness. The truth may sit somewhere in between, frustratingly intangible. Tedros chose to publicly endorse the contribution. Critics chose to publicly question it. Both narratives now coexist, and neither is disappearing anytime soon. That's the world we inhabit, layered, skeptical, reactive. The Sussexes remain lightning rods. Every gesture is scrutinized, every photograph dissected, every word parsed. But here's the closing thought I'll leave you with. Long after headlines fade and social media storms move on, the real metric will not be applause or outrage. It will be outcomes. Did children receive sustained care? Did mental health services expand? Did refugee support strengthen in measurable ways? Optics evaporate. Impact endures. If you found this analysis thoughtful, give the video a like, share it with someone who follows royal affairs closely,